Welcome everybody. In today's video we are going to cover 50 high-yield rapid review questions for your Family Medicine EOR. These questions are from NCC PAEA Blueprint for your PANCE and EOR exam. So let's begin. Question number 1. Rheumatic fever, most common bug is. So one of the tips I can give you guys, when I was studying for my PANCE and EOR, I would always make little mnemonics or little stories along the way to help me memorize the information. And how I remember rheumatic fever, most common bug is Streptococcus pyogenes. And I would ask myself, what does rheumatic fever bug like to do? What does it like to eat? And the way I remembered it, rheumatic fever bug loves to eat the pies. So pie, pyogen. So if you see rheumatic fever in your stem and it's asking you what's the most common bug, look for pyo in the answer, Streptococcus pyogenes, and you'll get it right. Question number 2. How to differentiate stable angina versus unstable angina. And there's two ways that I remember this. One is with time and one is what is happening during the rest. So stable angina is relieved by the rest, while unstable angina occurs at the rest. So if patient is resting and they still have substernal chest pain, then you should be thinking of unstable angina. But if they say they got angina-like symptoms and they get better while resting, that's stable angina. Another one is by the time. Stable angina lasts 2 to 5 minutes, while unstable angina can last longer than 10 minutes. So look for those two things in your stem. If they're telling you the patient has symptoms greater than 10 minutes and these kind of symptoms occur at rest, you should be selecting unstable angina as your answer. Otherwise, you should be thinking about stable angina with pain symptomology relieved by the rest and symptoms lasting 2 to 5 minutes. Question number 3. Most common cause of non-cardiac chest pain in emergency department. So they're going to tell you EKG is normal, they're going to tell you all the labs are normal, and they'll be asking you what's the most common cause of this patient's chest pain, and the answer is GERD. AFib patient is at increased risk for what? So if we think about atrial fibrillation, you know the heart rate is greater than 100 to 120, maybe more. And with that much blood being spun that much faster in the atrium, there's possibility of forming clots. And with every clot, you know there is an increased risk for stroke. Question number 5. Rheumatic fever is most prominent in what age group? Before we continue, I would love to thank you guys for all of you who have subscribed and helped me grow this channel. I just recently hit 1,000 subscribers, and thank you very much for that. For those of you that are new to the channel, please feel free to look around for other review videos like this. I will make a review video like this for every EOR, and I'm going to try and make one for every class and didactic year to help you with your PANCE throughout your PA school. And please go ahead and hit that subscribe button, help me grow this channel, hit that like button, leave a comment, and for extra good luck, thank you guys, thank you for watching this, and let's continue. Rheumatic fever is the most prominent in what age group? And that would be kids 5 to 15 years old. So they're going to tell you the kid is 10 years old, the bug is Streptococcus pyogenes, because now we know that rheumatic fever bugs love to eat the pie, and you're going to be looking for kids that are 5 to 15 years old. Aortic stenosis, signs and symptoms. So when we're talking about aortic stenosis, the mnemonic I always remember is SAD or ASH. So they're giving me a long stem and they're going to say syncope, angina, dyspnea, SAD, SAD, syncope, angina, dyspnea, or ASH, angina, syncope, heart failure. So that should make you think of aortic stenosis. And then that being said, I know aortic stenosis is the right answer. Weak dilated pulse is called what? They're going to give you a stem, they're going to tell you the patient has a really weak dilated pulse, and they're going to be asking you what is this called? Or they're going to give you a pulsus parvus L tardus. So they're going to say patient has dilated pulse. They may actually just state it and say pulsus parvus L tardus is present. And this is most commonly seen with which heart issue? And that should make you think of aortic stenosis. And the way I remember that is pulsus parvus L tardus, PPET, PPET, PPET. For some reason, to me, it sounds like puppet, PPET. So I'll just say who plays with the puppets, aortic stenosis does. So if I see pulsus parvus altardis, PPET, puppet, aortic stenosis. Dressler syndrome is most commonly seen when? They're going to tell you this patient has certain conditions. They may even state that Dressler syndrome is present, and most commonly will be seen after an MI. So if you have a patient with an MI, comes in 7-10 days later and it's got all these new symptoms, so the Dressler syndrome should be high on your differential. So all of you guys that already got the book, thank you very much for all your support. For those of you that haven't, please go ahead, check it out. All of these questions, just like this, super high review questions, are all combined in one book with over 3,800 questions. I had great and amazing reviews so far. These are the questions that I studied in my school, and it was super helpful for all my students. And go ahead and check it out. See how you like it. It's on Amazon. It's $20. And let's continue. Patients with peripheral artery disease will have what kind of cap refill? So if you think about peripheral artery disease, we already know that patient has decreased blood flow, and with a decreased blood flow, we can expect the capillary refill to be also decreased. Treatment for peripheral artery disease. So they're going to tell you the patient has peripheral artery disease. They may even give you test results, and the treatment you want to choose is cystazole. Guys, I always had a hard time pronouncing all the medication stuff because there's like just some funky names out there. Pharmacists just are having fun with it, I guess. Silostazole. There you go. I think I pronounced that one right. I don't know. Leave a comment if I pronounced that wrong. Yeah, cystazole. Use of what drug can cause aortic dissection? So they're going to tell you the patient has dilated mediastinum. They're going to tell you the patient has all these symptoms that are leading you to believe aortic dissection. They're going to tell you use of which drug can increase possibility of developing aortic dissection, and that would be cocaine. So once again, look for a STEM question that says patient was partying over the weekend. They were having a great time. They were using cocaine, and cocaine can cause aortic dissection, or it can give you a stem with aortic dissection and ask you which drug it was, vice versa. Aortic dissection, cocaine. Aortic dissection presentation. So they're going to tell you the patient comes in with a ripping, tearing chest pain that is radiating to their back. So the stem could go along the lines, patient was partying in Vegas, had a great weekend, and then presented an ER on a Sunday night with ripping, tearing chest pain radiating to the back. Use of cocaine should make you all think of aortic dissection. What's Homan sign? So the Homan sign is a DVT sign. So they're going to have the calf pain with a dorsiflexion. So they're going to ask you in a STEM, you perform a physical exam, and while palpating the calves with the dorsiflexion, patient exhibits pain. That is positive Homan sign and should make you think of DVT. Loop diuretics contraindications. So in the STEM, they can ask you about prescribing loop diuretics. But one of these is a contraindication, so you should know the contraindication for a loop diuretic is a sulfa allergy. And they'll probably just tell you patient had a Bactrim in the past, had some side effects. Now with a sulfa allergy, which one of these cardiac medications should not be prescribed to this patient, and that is a loop diuretic. So loop contraindication is sulfa, Bactrim. Asthma presentation triad. So a patient comes into the ED, family medicine, pediatrics, and they have signs of wheezing, cough, and shortness of breath. That should make you think of asthma as one of your differentials. Most common sign of emphysema. The most common sign of emphysema is dyspnea, which accessory muscles are being used, prolonged expiration, and decreased Fremitus. So they may also give you a STEM. They say patient has dyspnea, and while performing a physical exam, you notice a decrease in Fremitus. What is the most common cause? And that should be emphysema. Barrel chest and a pursed lip breathing are seen with what? So if you have a patient that has a barrel chest and they get a pursed lip breathing on exam as you're like observing the patient, all of that should make you think of emphysema. But when it comes to the blue bloaters, that is referred to chronic bronchitis. So blue bloaters, chronic bronchitis with barrel chest and pursed lip breathing, emphysema, both of them will have the congestive heart failure likely. Most common cause of community-acquired pneumonia. So they're going to give you a stem, patient has pneumonia, and it's going to ask you what's the most common cause, which bug, and that would be strep pneumo. And I think this one is easy to remember because pneumo means lungs, PNA affects lungs. Pneumonia, lungs. Streptococcus pneumonia. Most common cause of walking pneumonia. So they're going to give you a long stem and they're going to tell you this patient is a soldier or is being reported from college dorms. So the most common cause of walking pneumonia will be mycoplasma. So mycoplasma, dorms, or military. Most common cause of viral pneumonia in a transplant patient or HIV patient. So once again, you're going to have a stem. They're going to tell you this patient is HIV positive, or they could have like a lung transplant or something. And now, and the chest X-ray shows the viral pneumonia, and they're going to ask you what's the most common cause of this viral pneumonia, and that would be CMV. So CMV, HIV patient, transplant patient. But when it comes to the pneumonia, a viral pneumonia in infants, that would be RSV. So look for the age of the patient, look for demographics. So HIV patient, transplant, CMV, infants, RSV. Bird bath dropping exposure should make you think of what? So they're going to give you a stem, they're going to tell you a patient is into the bird watching, he's going into the caves, he's looking for bats, he's a biologist of sorts, something along with the bird bat dropping story, and the answer is histoplasmosis. Histoplasmosis is the cause, and the way I remember this, who has history of bird dropping exposure. So if any STEM question has a bird bat droppings in it, you should be thinking about who has a history of bird dropping exposures as your answer, histoplasmosis. Aspiration pneumonia treatment. They're going to give you a stem. They're going to say the patient is an inpatient, or it could be a kid or an elderly person that now has aspiration pneumonia, and the treatment is clindamycin or metro. So the one other way I remember this is Linda got aspiration pneumonia in a metro. So aspiration pneumonia, who has a Linda, and she got it at a metro station, that is. I hope the pictures help. Most lung cancers are. So they're going to give you a stem and they're going to give you different lung cancers, and they're going to ask you which one of these are most commonly seen in the lung cancers, and the answer is non-small cell carcinoma. 85% of the lung cancer guys are non-small cell. Adenocarcinoma location in the lungs. So another STEM question could be something along the lines that tell you there's a lung cancer noted, and they're going to show you x-ray. It's either in periphery or central, so you should know that adenocarcinoma location is always peripheral, while small cell carcinoma is central. Pancreatitis pain is relieved by leaning forward. Nausea, vomiting, fever are also common. So they're going to give you a stem. The patient comes in after a weekend of drinking. They get all this abdominal pain, but they report that every time they lean forward, the pain gets better, but they still have nausea and vomiting, and a fever might also be present. So any pain that is better with leaning forward should make you think of pancreatitis. What is the triad of the chronic pancreatitis? So they may ask you to differentiate chronic versus acute pancreatitis. They may list both of them in the answer, and you should know with the chronic pancreatitis, there's always calcifications present in the pancreas, which can be seen in a KUB as like bunch of little white dots. And they may also report a patient's got that super foul smelling stool, pale stool, bulkier stools. It may even say that it's floating. That happens because of the high gas content and diabetes. They may also say the amylase and lipase will be normal. So if you have amylase and lipase that is normal, calcification present on an x-ray, and a report of foul smelling stool, that is more indicative of the chronic pancreatitis versus high amylase and lipase, which is seen with acute pancreatitis. Most common pancreatic cancer. Most common pancreatic cancer is a ductal adenocarcinoma, and it's most commonly seen in the head of the pancreas. Large bowel obstruction in adults, it's most commonly caused by what? So they're going to give you a stem, they're going to show you an x-ray that is indicative of the large bowel obstruction, and they're going to ask you which one of the following conditions is the most common cause of the large bowel obstruction, and that is a colorectal cancer. So CRC, colorectal cancer, large bowel obstruction. When it comes to the colorectal cancer, you're going to get a barium enema x-ray, and that will usually show an apple core lesion. So if you see an apple core lesion on your exam, it's going to talk about large bowel obstruction. Think about colorectal cancer. Colorectal cancer, apple core lesion, barium enema x-ray, and large bowel obstruction. So those four go together. Large bowel obstruction, colorectal cancer, barium enema x-ray, and apple core lesion. Most common bug in a cholecystitis. Most common bug is E. coli. Cholecystitis, E. coli. They're going to ask you what's the best scan for cholecystitis. So when reading the question, pay attention if they're asking about the best versus next scan, because that can trip you up and make you select the wrong answer even though that you know your content. So when it comes to cholecystitis, the best scan is a HIDA scan. And the next scan for any right upper quadrant pain should be ultrasound. But if it's asking for best scan, that's a HIDA scan. Next scan should be ultrasound. Most common location for ulcerative colitis. Ulcerative colitis is most commonly located in the left lower quadrant, and a bloody diarrhea is a hallmark of the ulcerative colitis. So long stem or short stems, patient presents to the urgent care ER, they notice some blood in the diarrhea, and they're going to ask you what's the most common cause of this, and you can say ulcerative colitis with the confidence. Crohn's disease, most common location. So we know that Crohn's disease can happen from mouth to anus, but they're going to be asking you following locations, which one is the most common for Crohn's disease, and that would be terminal ileum. A fibrous ring located at a lesser esophageal sphincter causes only large diameter foods to get stuck. So they're going to give you a stem, say patient went out for a dinner, had some steak, had some wine, and started choking, and the most common cause of this would be Schatzki's ring. So I hope you guys like these kind of questions. You can see why the high yield stuff is important to recognize in the STEM, so you can get the right answer, because when you press for time, you can just move through the material faster and keep up those high scores. So question 37, which meds can cause esophagitis? That would be NSAIDs, beta blockers, calcium channel blockers, and bisphosphonates. So they're going to give you a stem, and they're going to say which one of the following medications. They'll list 3 of these, and then they'll add something else and say which one of these is not a cause of esophagitis. Or they can ask you for only one of these and list 3 other types of medications and throw in a beta blocker, and they'll be asking which one of these is cause of esophagitis. So known by NSAIDs, beta blockers, calcium channel blockers, and bisphosphonates can all cause esophagitis. Zofran can cause what? Zofran is a medication treating nausea, but it can also cause prolonged QT. So this is a really common pimping question in an ICU in your inpatient rotations. They're going to ask you, like, patients super nauseous after their surgery, they're asking for some medication, and before you give them Zofran to treat the nausea, you should check what, and the answer is their QT. So if it's prolonged QT, you should opt for some different medication. Most common cause of gastroenteritis in adults, and that would be norovirus. Most common cause of gastroenteritis in adults is norovirus. And the way I remember that is somebody comes in with the symptoms of gastroenteritis, I'll be like, oh no, he got a gastroenteritis. So if you see and you pick up this gastroenteritis, it's going to ask you which virus is the most common cause. I'll just remember, oh no, he got a gastroenteritis. No, norovirus. Triad of lupus. That would be fever, a malar rash, typical butterfly rash, and a joint pain. So somebody comes in with fever, they got a butterfly rash on their face, and they also say they got all different joint pains. You should be thinking of lupus. So in the STEM, they may list one or two. If they're nice, they'll list all three, and they'll ask you which of the following conditions is the most likely cause. And if you see fever, rash, joint pain, think lupus. Lupus treatment. Refer to rheumatologist for meds, hydrochloroquine. Patients should avoid the sun. So they're going to ask you, patient has lupus, what is the next thing you want to do? I would like to refer them to rheumatologist. They need to get hydrochloroquine, and they may even give you a stem along the lines the patient has lupus. By the rheumatologist, they're being prescribed hydrochloroquine, and which one of these things they should be avoiding. And they may say sun, they may say pool, they may say different things that make you trip. But you should know the hydrochloroquine, lupus, these patients should be avoiding exposure to sun. Addison's presentation. That would be hyponatremia and hyperkalemia. So if you have a patient, the blood work came back, they're super low sodium, high potassium, that should be making you think of Addison's disease. And the way I remember this is Addison's diet is salt-free and she eats a lot of bananas. So they're going to ask you, patient has Addison's disease, what can you expect to see in the lab work? They're going to give you hypernatremia, vice versa, hypokalemia, hyperkalemia, or hypo. Just think of what does Addison's diet consists of. Her diet is salt-free, hyponatremia, and she loves bananas. Hyponatremia, hyperkalemia. Cushing's versus Addison's when it comes to the pituitary. So in Addison's, pituitary did not release ACTH, and in Cushing, it has released too much. So in Cushing's disease, you're going to see high levels of ACTH, and in Addison's, it did not release it. What can cause excess ACTH secretion? That would be a small cell lung cancer. So if you have a patient with a high ACTH, you should also have a small cell lung cancer on your differential. Pretibial myxedema, a skin condition that causes plaques of thick, scaly skin and swelling of the lower legs, should make you think of what diagnosis? So you're doing a physical exam and you find this pretibial, the lower leg, super thick, scaly skin. That should make you think of Graves' disease. So that should make you also check their thyroid and prescribe proper medication. TCH in a pituitary adenoma will be increased. So with pituitary adenoma, TCH and T4 are both going to be increased. MS will have cerebrospinal fluid findings of multiple sclerosis, They're going to tell you patient comes in with vision issues, peripheral neuropathy, it's usually, when it comes to MS, it's usually a young female, predominantly Caucasian of the Northern European descent, with new vision issues, some peripheral neuropathy, and you performed a lumbar puncture and a CSF. Findings are IgG oligoclonal bands. Or they can reverse a question and say patient came in with vision issues, peripheral neuropathy, neurologist performed lumbar puncture, and they found IgG oligoclonal bands. This is indicative of what? That is multiple sclerosis. So, multiple sclerosis, oligoclonal bands in the lumbar puncture. Clone band plays MS music. I don't know how good of a little story that is, but it helped me. I'll just think of clone band, oligoclonal bands. So clone band of clones, and they were just playing like not reggae, not rap, not rock, but they were playing MS music. So just maybe because of the word band in it made me think of music. Most common cause of Bell's palsy. This is a commonly pimped question. This is a question you'll see on your exams, and the most common cause of Bell's palsy is HSP. Prophylaxis for cluster headaches. So they're going to give you a stem. They're going to tell you patient has cluster headaches due to the symptoms, or you'll have to figure out it's a cluster headaches, and the prophylaxis is CCB, calcium channel blockers, nimodipine. And the way I remember this is Nemo never gets a cluster headache. So when they say prophylaxis, prevention, and they talk about cluster headache, I was like, well, who never gets a cluster headache? Well, little Nemo, nimodipine. So I'll just look for pine, P-I-N-E at the end. That is indicative of calcium channel blockers, nimodipine. Nemo never gets a cluster headache. Bladder cancer, most common type. So they're going to tell you this is an elderly patient that has blood in their urine, which should make you think of bladder cancer, and the most common type is a transitional cell cancer. So that is all, guys. We made it through. Best of luck to you on your EOR exams. Once again, check out a book, 3800 questions like this. You will do great. Keep going, keep pushing. Remember, thousands and thousands of students have done this before you, so you can do, period. Hit that subscribe button, leave a comment. Best of luck, and I'll see you guys in the next video.